Good afternoon. Thank you very much for inviting me along to come and talk to you today. I'm really looking forward to this session. We've been spending a lot of time this year thinking about how HCPs are responding to their information needs, particularly through the COVID impact. We've seen some of the trends that have been in place already are really beginning to accelerate. My name is Jane Marks. I'm VP of Global Publishing at Wolters Kluwer, and I want to give a big shout out to my colleague Nick Shaponik, who has put together a lot of the data that you'll see in the slides. So let's get started on what are we going to talk about today. A little bit about what we're seeing in terms of what HCPs want in the way of accessing content, and then how we're responding as an organization and as a content team to what kinds of information and how we can put that out in different ways. And then we will wrap up with a few sort of take-homes at the end. So what is changing? This is some data that we've put together during 2020. So it sort of started off at the beginning of the pandemic, and it's been tracking the market as we've gone through the year. And what we're seeing is, as you can see, all of these blue lines that have increased down this slide. This is where HCPs are turning to their websites, they're turning to resource centers, to various different society websites, newsletters, e-newsletters. They're looking for digital ways to get the information they need, to get it fast and to get it relevant. We are seeing some decline here, as you can see in print, and obviously discussing with colleagues is not as easy as they were able to do before, so that's obviously declining, and all these digital resources are increasing. So what we're also seeing, and this is not a trend just for this year, we've seen a massive increase in the amount of time that HCPs spend on their digital resources and looking for information online in different ways. And how do they do that? I think this is what's interesting. It's not just their desktop, it's not just their phone or their tablet. It is a real blend of all of those things. And it's really in context of when they need information, perhaps on the go, it will be their phone. When they're actually sitting and really researching something, it will be their desktop. So thinking as we go through our content development about how we can make content most appropriate for lots of different kinds of devices and at different touch points during the day. So how do we go about creating this kind of accessible content? What kinds of things are we thinking about that go beyond a straightforward journal article? So the first one I think is thinking about plain language summaries. It's sort of a no-brainer, really, that if something is very easy to understand and to read, and immediately you get the talking points of what's important in this paper, you're much more likely to want to go further. If an abstract is really very dense and it's hard to understand what the key take-homes are, then I think it's less likely that somebody will dig deeper. The other thing, of course, is it gives an opportunity for the broader team and perhaps even patients to be able to access data in the same way. I think we definitely believe that readers are more likely to open a full article if it has a plain language summary or an infographic. Now, it's what we think. We definitely need to do more research on that, but it's something that we're working very hard to make our content more accessible. So interactivity, I think, is really interesting. Posters, for example, have been a really good way, infographics have been a really good way of pulling together key important pieces of information. But they're basically just points of information on a flat page. It's much more interesting, particularly in the digital world, if you can pull out, as you scroll over a page, key things that are important that you want to attract the interest of the reader. Maybe you pop up a video, maybe you can pop up just an inset screen or a podcast, anything that really makes something much more engaging, encourages people to go deeper into the content. So think about other kinds of graphics as well. This one here is an example of one of our charts that we have often see on healthcare professional walls. Can we turn those into a digital world where you can actually zoom in and out of different parts of a chart to make it much more interactive and much more accessible to different kinds of readers? Podcasts are something that I think have been really starting to grow in interest. I think this data is fascinating. 90% of podcast listeners pay attention to ads. 80% report positive brand recall. I think that's a very, very high percentage and really encouraging for this kind of engagement. 67% able to recall product messaging. And this is coming from a broader consumer podcast study that was done last year. But I think it's really interesting that we can now start to use more and more this kind of audio engagement to attract healthcare professionals and then put different placements in there. I think this last point is very interesting, is that our podcast traffic is not coming generally in over the web. It's coming very targeted from the audiences that our journals and our other content is trying to reach. So it's very much in context and hitting the people that really want to understand that information. Video, I think, is the way of the future. It's the way that people want to access content. So if there is something that is certainly video easy to use, it is definitely something worth thinking about. How do we put our messaging of how we want to get to healthcare professionals into video, and how do we use video that they are sharing with each other to attach messaging that's appropriate and in context. And many of our journals now have video libraries. They're trusted sources. They come from the readers of those journals, the authors of the journals, and they're very highly used. So how do we think about how we can take this different content and our different ways to reach out to the community to help people to cross-train their team? More and more we're seeing as HCPs work more as a team, as people become more cross-trained, that this kind of thing becomes much more important. So how can we help do that? So if you think about an individual journal, it's going to one particular audience. In this case, gastroenterologists. Perhaps we want to have an obesity message there. But that's just one audience. There are other ways that we can help get to the same audience with people who have different but definitely adjacent interests. So if you think about a wide range of different journals with their readerships all of their own, and then each of them then can then work with our nurse and our physician assistant publications to give you that complete team message. So thinking about how those messages can be appropriately positioned across a range of publications or websites to take people from one particular area out to their broader team. And then, as you can see here, that massively widens the reach of the particular message that we're trying to get out. So next screen. So the other thing is thinking about how do we go into those adjacencies? How do we take different ads, not just into one specialty, but how do we think about who else in that team might need to understand that? So think about nurse practitioners, thinking about physician assistants, etc. There are lots of different ways that we can get to those different communities with an appropriate message around a particular topic. So I'm going to touch very briefly on virtual meetings. We've spent quite a bit of time thinking about how it is in today's world where physicians are not able to communicate with each other in person. They're not there walking the halls. They're not there talking to each other. And it's a very important part of networking and education. And so how do we make sure that a lot of the ways that we communicate with physicians, we help our partners communicate with physicians, and how can we turn that into a virtual experience? So one thing we've discovered as we have rolled out various types of virtual support for our society partners, is that virtual exhibit halls just do not seem to be working, not for HCPs. Now, I'm sitting here in a virtual conference, and I know that we have a virtual exhibit booth in the virtual exhibit hall. So I'm hoping that you're all going to come and see us immediately this presentation is over. You're going to come to our booth and you're going to prove to us that virtual exhibit booths do work. So do come along and tell us if they work for you, and more importantly, tell us if they don't work for you. Tell us what you would like to see and how you would like to engage with us. So what we're looking at is how can we drive engagement with our audiences both before meetings and after. So how can we use the messaging? How can we use that audience and the content that we have to create different ways of engagement? How can we interest people in that content for the conference by perhaps bringing them to product theatres, etc., or maybe symposia that are focused on particular areas before the attendees get into the research content that they're going to at the actual meeting. And then, of course, thinking about how do those content types, how can you use different content types to attract people in? Thinking about how do you use video perhaps in virtual posters? How do you use video in your booth or perhaps elsewhere on the site if that's possible to bring people into your messaging and to engage with them and to start a conversation? I think this is an area where we're really at the beginning of starting to reimagine and reinvent. And I think there's some way to go. So we're very keen to engage with the community and understand what you're seeing and what you want and how you want to drive that engagement. So definitely more about that later. So next slide here. So how do we think about expanding access to content going forward? So I think as we go forward, it is going to be critical that we think about how healthcare professionals want to engage with content, how their needs have changed, and how in the publishing world we have to stay relevant, how we have to evolve our journals to make sure, and our other websites to make sure that we're still relevant as we go through this big change in the market. There is no doubt that journals will have to adapt. We will see journals trying different ways to enhance their content. We want to make sure that that content, that a wide range of different kinds of people who need to get to the content can find it, and that its implications can be understood. We've all seen papers that have been published recently that have been promoted perhaps in the broader press that have been perhaps misunderstood. So it's how can we really accurately communicate the output of the research that we're publishing, and how can we make sure that it's really of interest to a broad range of readers that we might want to reach out to. An area that I think we see that is definitely proliferating now, and I think is here to stay, is preprints and conference presentations, for example. Anything that is pre-journal publication, we're going to see more and more of those, and more of the early research is going to come out before the final paper. So how can we, as a community, engage with those that early content, engage with the authors and with the content to make sure that we can navigate healthcare professionals to the right content at the right time and with the right messaging? How can we help them to do that? I think this next point has proved to be very interesting over the last few months. Critical research that is really important to the community needs to be freely available when it's urgent. And I think you've seen right across the industry, everybody really working together to try and make sure that anything that is relevant to COVID is easily accessible and is free to the end users. And how can we make sure that we can put that content in front of healthcare professionals who need it today and really have urgent access? And it's been very interesting to see across a wide range of different journals, how all of them have really focused in on how does COVID impact their community? How does COVID impact their particular discipline, their healthcare professionals? And all of them have come up with different ways to create focused areas, and perhaps collections of content, perhaps just basic information about this is the new protocol for treating a particular manifestation in different ways. So it's definitely worth focusing in on individual disciplines and thinking about how they need to communicate with each other about things that are urgent and moving fast. And lastly, I would say it's really important to listen to what our customers want going forward and to keep responding to that and keep working with new things. And thinking about listening to our customers, I mean, the first thing that we want to do here is to really understand what you're interested in and to engage with you. So we have quite a wide range of questions coming in already. So I'm going to turn over to those questions now. And so let me see. First one here, because I think not everybody can see the questions. So are we finding that HCPs are easier to reach with more reliance on digital channels, or has COVID made engagement more difficult? That is a really good question. And I think that's where thinking about individual disciplines, thinking about communities around particular topics that are really important. And I think this is where networks around professional associations, professional societies have really become incredibly important this year. And I think this is where we see that communication channel working very effectively and very actively. And I think if you talk to any society where their membership has been very involved in the treatment of COVID patients, they have been incredibly busy in keeping all their information channels updated and accessible. Of course, it's much harder, I think, obviously, to reach people with print if during this last few months, and in that sense, digital channels have definitely been the way to go. And I think there is no doubt that people are hungry for information and hungry for new things. They're much more aware of them and they're looking out for them. So you see an interesting email that comes in that might give you information, might be a newsletter around a topic that's really important to you, much more likely to dig into it. So in that sense, yes, I think we have seen better engagement there. So this next question is very interesting. So do different user platforms, desktop versus mobile, lend themselves to different ways of showing the data? For example, does an infographic get more views on mobile, whereas a white paper get more views on a desktop laptop? Yes, I think that's true. I think it's very much about the time on the device. I think time on a device, something on a desktop, if you're going to be reading for a long time, perhaps looking at images next to large volumes of text, yes, definitely much more appropriate for a desktop. Smaller snippets of information, podcasts, video, infographics, any kinds of images or anything like that, they definitely work well on mobile. But what we have to do is to think about how can we combine those experiences, thinking about the layers that we were talking earlier, making things interactive. So can you have a simple image that maybe when you scroll down, different parts of it will then come up? So I think, yes, I think thinking about context specific and what kinds of messaging and where they might be seen, definitely worth doing. How can we effectively amplify published articles and get more eyes on the published article? That's a great question and something that we're working on really hard at the moment. And there are a number of different ways that work very effectively. We certainly work with authors and with our editorial teams to use social media to get the message out about articles that are really important. We use the infographics, maybe video, so those sort of snippets that can be very easy to attract people's attention. So we do work very closely with that community to get those messages out. And social media has proved incredibly useful to get articles talked about amongst a community of interest. Obviously, we do quite a lot to pull together articles that are like interest into resource centers, etc., making sure that content across maybe a range of publications, individual articles that perhaps are relevant to the same reader, can be accessed in the same place. So those kinds of things, I think there are ways that we can do that, and ways that we can use really good digital tools to get people to actually go and read the content. So how can you anticipate HCP needs during unprecedented times, and how have you learned to be agile in the past few months? That is a great question, and it's something that I think we've particularly focused on quite hard. So you can see, I'm going to go back to the previous slide here. You can see there have been a number of journals that have created COVID-related specialty areas. And we've had our publishing teams working with the editorial offices, sometimes the societies, to really work out what's most useful for that individual community. And then how do we get the message out? How do we bring people to this content that's so relevant to them? So that is how we've been agile. We've also actually experimented with a number of different things, putting content or different tools out there, perhaps that are free for people in particularly difficult situations. For example, when there was a lockdown and suddenly people didn't have access, perhaps to the library, could we make some more of our digital resources openly available faster to allow people to have access to content that they needed? And then we've been working a lot with our societies on how they can turn their different in-person meetings into something meaningful that's virtual, whether it's their education meetings or their annual conference. How can we really think about that content and making it relevant to the way that the situation that we're in? It's hard to anticipate, and I think what we have to do is to constantly talk to our customers, talk to our readers, and our authors, and find out what's happening with them on the ground and how we can best help them. So I think I have perhaps one or two last questions here. There was a comment, I think, earlier on. There was in one of the earlier slides about print resources being in decline in 2020. That is not just a response to the pandemic this year. Print has been in, I would say, somewhat decline, and certainly some slow decline for quite a number of years. There is still a large percentage of our readers, our healthcare professionals, who still want their physical print, but there is no doubt that that trend is continuing, steady. I don't see it falling off a cliff. I don't think any of us in Wolters Kluwer do, but it will continue to decline. And so it's very important to us that we continue to build new digital resources and digital channels that allow us to communicate as effectively with our readers and allow our partners in pharmaceutical companies, device manufacturers, etc., avenues to communicate with our readers in a way that works for them. The next question is very interesting. So of the different kinds of delivery tactics, video, podcast, infographics, what is having the highest impact, and what do you see being the most important moving forward? I go back and forth on this, and I think it depends on who I talk to, whether the flavor of what they're interested in can be video, podcast, or infographics. Some of it is undoubtedly dependent on the field. So surgery adopted video early, is definitely wedded to video, and I don't see that going away. I think infographics will always have a role in helping to very quickly and succinctly get to the nugget of information. But if you think about different kinds of learners and different and the way that people assimilate and retain information, there will be audio learners, visual learners, and people who would like to read something. And so having that mix is really important because the eyeballs that we have on our content have less and less time. So it's really important that the content we give them is appropriate to them and works for them as to stay updated. Yes, I do think it is. I do think we are seeing social media working. We're seeing social media definitely driving people to our content, as I mentioned earlier. And I think having infographics or short video clips are a great way of getting people to then engage with that content and that message and then go deeper into the journal article later. So I think we are almost out of time. There's one more question here about. So there's great information in the deck. Thank you. Yes, it's definitely available. It is available at the end in the library, I think, and certainly come along to the booth, and we can make sure that you can have a copy of the presentation there. So thank you very much for listening, and we look forward to engaging with you later. Thank you. Bye bye.